Joe Ivy, thank you very much indeed for the chance to be here. I reckon I know or have worked with half the people around the table at various times in my professional life. And so I'd like to start by explaining where I've got to personally and giving you a brief resume, just turning off my phone. And then I'd like to go into the subject and relate my experience to what it is you're going to be doing during this very important forum. So most of you know me as a long-term public health professional, and I did come into public health after working as a pediatrician for 10 years, mostly in Southeast Asia as well as in the UK. And then I shifted from my pediatric work to become a public health physician in the 1980s, and gradually tried to engineer that I could move from a strict public health role into more of a development role, given my persistent recognition that the underlying causes of morbidity and mortality in almost all human systems are those on which we have to concentrate if we want to see long-term improvements in the health of populations. And so that led me eventually to spend 10 years in the British government, initially in an organisation called the Overseas Development Administration in the early 90s, and then in what became the Department for International Development. And I shifted from being the director responsible for health to becoming the director responsible for human development, again reflecting my wish and my employer's wish to see health in a broad and holistic sense. And then when Gro Harlem Brundtland joined the World Health Organization in 1999, I went to work with her to lead the malaria program that Dr. Brundtland wanted to give a bit of a turbocharge to, and we decided to really seek ways to turn malaria from being a backwater issue to being an issue which could really get increased global attention by simplifying the paradigm for the actions that needed to be taken to get progress on malaria, and then gradually trying to embrace different private actors, civil society actors, and academic groups in a much broader approach to address malaria than had hitherto been the case. And this reflected Gro Brundtland's absolute commitment to a much wider group of multi-stakeholder involvement in health issues. And I think it worked. I think we were fortunate that just at that time, governments were looking to establish a new fund for health. They were concentrating initially on HIV/AIDS, but it was possible, with the support of Kofi Annan and others, to bring malaria into the orbit along with tuberculosis, and that led to the Global Fund being formed, and that provided an impetus for a much broader collective action on malaria, which has had extraordinary results in the last few years in terms of reduced morbidity and mortality, very much as a result of collaborations around key strategic objectives between business, civil society, academe, and governments, with international organizations playing more of a catalytic role rather than a controlling role, as was the case in the past. And that period of excitement from 1999 onwards coincided with real revolution in thinking about public health due to what was happening in the HIV/AIDS field, where Peter Piot particularly, together with building on the legacy of Jonathan Mann, showed that you can actually get a much broader and more exciting approach to health outcomes if you actually from the start see the work as one that involves true partnership amongst multiple actors, not just civil society and business, but also getting presidents and prime ministers fully engaged, as happened, for example, with the President's Initiative on HIV/AIDS that took place in this country, PEPFAR, and bringing in, therefore, a much greater ownership than was the case if it was just left in the hands of ministries of health. And really, HIV/AIDS has just never been the same since that period in the mid-90s, when efforts were made to increase the engagement and to bring in different groups of actors. And so those two, malaria and HIV/AIDS, influenced my thinking about this a lot. And during the succeeding years in the World Health Organization up to 2005, I continued to work with others to try to make certain that on just about every issue, we sought to seek the involvement of multiple stakeholders. In nutrition, the setting up of the Global Alliance to Improve Nutrition, obviously tuberculosis with the Stop TB, a campaign that was established there. And so what we were, I think, able to do was to just shift the direction of health action in a very exciting way. Around 2005, I came to New York to work with Kofi Annan on avian influenza and the threat of pandemics. Again, we found ourselves wanting to stimulate multi-stakeholder action because avian influenza, at that stage H5N1 highly pathogenic avian influenza, was actually moving around in poultry, and we couldn't possibly address the threats posed by that virus without involving at all times the different groups of actors involved in the poultry industry, which is not an easy industry. It's an industry with a lot of small-scale actors involved, some regulations, and the vet sector has got some quite exciting regulatory instruments. But it was quickly evident between 2005 and 2008, when there was a really massive fear about the potential impact of H5N1 avian influenza if it did mutate and cause the next pandemic. It was clear that we had to, at all times, bring business in, whether it was the Association of Poultry Producers in Indonesia, or the large poultry companies based in Thailand, or Cargill's themselves, who had a big poultry operation and a set of franchises in Southeast Asia. And quickly it became clear that if we wanted to reduce the risk of H5N1 in poultry operations, the only way to do it was by engaging poultry farmers at all levels as actors in the effort to reduce the spread of the virus, both because their own health was at risk, but also because they were contributing to a wider risk for the global population because of the spread of the virus. In 2008, I shifted and was asked to take on food security because we had a massive rise in food prices going on, 30% rise in 4 months because of some problems, particularly in the rice market in 2008. And again, having been asked to help the United Nations really reorient its work on food security and sustainable agriculture and nutrition, a task which I stayed on between 2008 and really 2014, I again recognized, together with others, that the only way forward was to open our arms and to embrace and seek common working arrangements with businesses, as well as with academic groups and civil society. Now, here in food, things were not easy. This was an area which is riven with controversy. Controversy around infant feeding, controversy around agriculture strategies, controversy around subsidies, particularly in industrialized nations, controversy around the use of pesticides and fertilizers. This is not an easy street for working in partnership with others. And so in the food and nutrition sector, in the work that I was doing between 2008 and actually up to the present day, we have had to work to create platforms within which very different viewpoints about the roles of business, and the roles of different agriculture actors, the roles of food system operators, the influences of climate, the influences of concerns about sustainability, you need the platforms to bring people together that become safe spaces within which differences of opinion can be aired. And we set up a totally new governance structure for agriculture, food and nutrition, in which there were constituencies, you may know about this, constituencies of private actors, civil society actors, including farmers, academics, research groups, particularly because in food and agriculture we have the consultative group on international agricultural research, and of course governments. But by having space in which the separate constituencies were able to come together and at least to think through and work through some really tricky issues. Most recently, in the last few weeks, I have been meeting infant food manufacturers because they are extremely troubled about some of the things that have taken place in the recent World Health Assembly. I've also been working with farmers' associations, anxious about whether or not there's adequate emphasis on the role played by smallholder farmers in global food policies. But by having this governance structure that gives space for the different constituencies in a big roundtable format like this, it's not an easy environment, but it has at least helped us to cope with some of the tensions. It's called the Committee on World Food Security. It's based in Rome, and those of you who've got agriculture operations in your companies or who want to know more about it, we can easily get more information. Because interestingly, that kind of structure has not been created for the health sector. In health, we've had a different set of things going on. Some very exciting advanced partnerships on non-communicable diseases, on maternal and child health, it's called Every Woman, Every Child, and also partnerships around specific issues like road traffic accidents, where there's been good work with the alcohol industry. And these have been very exciting, but within the context of global governance, there has not been an environment which has led to the creation of a multi-stakeholder arrangement of the kind we've got in agriculture and food. Instead, the World Health Organization has had to negotiate a rather strange thing called the Framework for Engagement of Non-State Actors that was finally agreed after a lot of difficult negotiations in May this year, and which really does limit the degree to which WHO is able to enter into working arrangements with private actors, particularly businesses. This is because of a very powerful sense among a number of public interest, non-governmental organizations, that there has been excessive interference in the standard-setting work of WHO by businesses. This started around the time when we were negotiating the Framework Convention on Tobacco Control, when we had evidence of some dirty tricks by some companies to actually undermine the credibility of WHO and to try to skew WHO's work away from non-communicable diseases and back to communicable diseases. The Dirty Tricks campaign was subject of investigation that actually did come out with evidence that not good stuff was being done. And that led to the beginnings of a mistrust around the World Health Assembly over successive years. That was compounded by the long-term anxiety among public interest NGOs about what happens in the infant feeding market and concerns that there was inappropriate promotion of infant formula for young babies that was contributing to decline in breastfeeding rates and to malnutrition among children. And we have not really been able to work through those. Fortunately, AIDS has been relatively spared some of this stuff, but in other areas, and I think it applies now very much in non-communicable diseases, in diagnostics work, and in many other aspects of health, we don't have comfort in, at least in and around WHO, and that extends to UNICEF. And that's something that needs attention, and I'd be very happy to have discussion about that, because I believe it's not as clean and easy as it should be. That doesn't mean it'll ever be plain sailing. It's not plain sailing in the agriculture sector. There are still real challenges when we try to work on climate and agriculture, with anxieties from NGOs about whether or not certain types of companies can be allowed to come in. But at least we've got a space, a safe space for negotiating these things. I'm now working in a much broader variety of areas. I've got 17 areas for which I'm responsible, because the Sustainable Development Goals cover the 17 different areas that Joe Ivy-Bufford just indicated on the screen. So I'm not just looking at individual areas and looking at opportunities for partnership there. I'm now trying, on behalf of the international system, to look right across the board at interactions between public sector, private sector, civil society groups and research groups in multiple areas. And that also means that I've got to look to see whether or not there is scope for any kind of lesson learning in different areas, and then application of those lessons back. And during the next few minutes, I am going to give you some views I've got about what the options are. But before I do that, let me just give you just a few minutes on what it was that Joe Ivy was talking about, because it's worth digging into this. What Joe showed you was the results of 3 years of negotiation among all the members of the United Nations family. That's 193 member states at the last time of counting. A 3-year negotiation to try to establish what is now, in effect, the plan for the future of the world's people and the planet. Now, the Millennium Development Goals that were developed for 2000 and lasted through to 2015 were great, but they just applied to poor countries. When we met together in Rio de Janeiro in 2012 to consider what kind of future development planning was desirable for the world, the meeting, as tends to happen, broke up in disarray, and there was 24 hours left to salvage it. The key reason for the disarray and the issue around which it was salvaged was a number of countries saying very clearly, we're not going to have any new goals unless they are universal goals. That means goals for the whole world. Because there was a real sense among many middle-income countries that the Millennium Development Goals let the rich nations off the hook. And their argument was, rich nations are the primary polluters, rich nations are particularly involved in contributing greenhouse gases that are wrecking our climates, and therefore the rich nations have a responsibility to sort themselves out, as well as telling the poor world what it has to do. So between 2012 and 2015, very painful, sometimes acrimonious negotiations led to the agreement of a range of goals that reflect what needs to be done for the whole world, not just for the poor world. So that's the first characteristic of these new goals. The second characteristic is that the goals are designed as interconnected and indivisible activities. For the first time ever, we've got a goal for peace, justice, and institutions that will reduce conflict. For the first time ever, we've got a climate goal in alongside the rest. We've got other environmental goals. We've got a goal on sustainable consumption and production, as well as goals on what kind of economic development is necessary, particularly a redistributive approach, and also the way in which this work is going to be implemented for the first time ever, actually in a United Nations document, a recognition that multi-stakeholder partnerships are the way to go. That's in Goal 17, and that's really important for us all. Now, what does this represent? It does, as I said, represent a plan for people and planet. It's the only plan we've ever had. We do, of course, have plans in religious texts, the Bible particularly, but this is the first secular plan for the future of the world that's been agreed by everybody. And we don't have any other plan. Just as we don't have a spare planet. And so from our point of view, those of us who work within the international system, it is absolutely essential that we use every possible ounce of effort that we can to make sure that we do all that is possible to realize these goals. Now, they have 169 targets, many of which will be familiar to you, and within those there are now at least 200 indicators that have been selected to monitor them. There are some additional principles, including leaving no one behind, which means trying to make certain that we do find pockets of groups that are prone to be left behind, and that's why we're giving huge attention now to improving the quality of humanitarian assistance for the 125 million people who are suffering in wars or disasters around the world. And there's also a principle on making certain that all actions to tackle the issues raised by these goals are implemented in an integrated way. So in the United Nations, we are busy trying to integrate our work on peacekeeping and security with our work on human rights and justice, as well as our work on development. And in development, we're linking together our work on climate, our work on disaster risk reduction, and our work on gender equality and empowerment of women, together with our work on humanitarian action. And we have concluded, because our member states increasingly are telling us, that the only way this new agenda with its multiple facets will be implemented if it's a fully feminist agenda, and if it's viewed through the eyes, through the hearts and through the heads of women, given that so many of the aspects of this agenda require the multitasking and multi-issue capabilities that have been repeatedly demonstrated to be those that women are able to deal with much better than men. And as a rider, one could say that men have been in charge up to now, and look where we are, so it's time to do it differently. Now, what I want to stress on on this new agenda is the following. It's been agreed by world leaders. It's a manifesto, a political manifesto for us all. And that means that every company, every faith group, every university, as well as every government and every international organization should make certain that everything they do, everything, is in line with and will contribute to the realization of the goals. They are the business of everyone. And to do that work, we have to think differently, we have to act differently, we have to organize differently, we have to advocate differently, and we have to report differently, because they are interlinked goals across all domains of human existence. If you are experts in health, fine, come in through goal 3, but recognize that everything you do actually impacts on all the other goals, and also remember that health outcomes are influenced by what happens in all the other areas. If there's not peace, if there's war, we know women in particular get hit first and hurt worst. So we've got to make certain that we're combining our efforts for women's empowerment with our efforts to ensure peace and the protection of women, particularly in war zones, which currently is lacking. Again, if we go in through goal 3 on health, we've got to remember that the importance of drinking water and sanitation, goal 6, and also the relevance of sustainable consumption and production, goal 12. That ability to think laterally is going to tax us all. Many of us will say, hey, hang on, I'm not like that. I wasn't brought up like that. I don't know what you're talking about. The answer simply is to say we all have to learn to think and work horizontally rather than stay burrowed into our own areas of comfort. Now, I've mentioned to you that we don't at the moment yet have ideal platforms for working together. We are, however, in a situation in which it's becoming much easier for business, government and civil society to work on specific issues. And I know that in this meeting you'll be discussing, for example, some of the cooperations in Kenya that are really very exciting on improving access to effective healthcare that involve a number of companies, major NGOs and others working with the government. I know that you'll be talking about specific collaborations on diagnostics, and BD has been a wonderful partner for many of us over the years, and that's going to be great as well. And I know that you'll be looking at themes like HIV and looking at ways of going in more deeply there as well. So I'm encouraging you to do that, but I'm also encouraging you to think a little bit more meta and to think, do we need different kinds of arrangements globally, or at least in this country, that will enable more collaborative thinking and shared analysis of challenges and issues around the engagement of business, civil society and governments, together with academics and international organizations on health issues? Can we do more to build the body of knowledge about what's worked and what hasn't worked, so that we become just a little bit cleverer and smarter? Can we link sideways and partner with other networks? Could we partner with the people working on water and sanitation? Could we partner with people working on nutrition? Could we partner with the people working on education? There are some fabulous education partnerships emerging. Could we partner with the people working in crises, working with refugees and migrants? And are there ways in which, by working sideways and linking with other partnerships, we will be able to achieve more? And through that, can we go to the hard-to-reach places and actually concentrate on those and see if together we can find ways to better help people whose circumstances are just so awful because they are isolated from the internet or isolated from electricity, or they're difficult to access because of geographical terrain or unable to be accessed because of war. And then can we connect some of the dots about the underlying causes that lead to ill health? Those of you who've been involved, as many of you have, in the Every Woman, Every Child partnership that was set up by Ban Ki-moon, and it's become quite mature now and quite robust, are there ways in which we can together think about underlying causes of women's, children's and adolescents' ill health and work on them collectively? Again, perhaps not necessarily working through health services, but working at underlying causes of health linked to perhaps knowledge or nutrition or conditions in the home. So, Joe Ivy, that was just a bit of a canter. Started with myself, then talked a little bit about the goals, and then focused a bit on some of the specifics. But this is a really important group, Joe Ivy, because these are people who've been working on this area for some years. They know what can be done, they've had frustrations, and I believe that collectively you could come up with some really interesting ideas for letting this area grow and get much, much more impactful. Thanks.